So yesterday we started our discussion with the 5 points of battlefield acupuncture. The first point is cingulate gyrus, and the cingulate gyrus working on the emotional pain and the pain arising because of the emotional involvement. Then the second point we have discussed thalamus. Thalamus is the point connected with the outer stimulus. Then third we have discussed omega-2 as a great painkiller point. If the pain in the muscle or in the 206 bones, so this is the omega-2 we have taken. This point is also very good, whether the pain and inflammation in the arm or the legs. And the fourth point after this omega-2. So first point was here, this is the point number 1. The second point was here, there is the thalamus. The third point was here, there is the omega-2. And after that, the fourth number point, the central core of the human body, because we want to balance whole body. We want to balance the core of the body. So the point 0. Point 0 is the core of the body. So this is the point available in the center of the ear. And the final point, that is a tranquilizer point or the gate of the spirit. So ultimately, when we are entering in the divine place, so we are very peaceful, calm, and quiet. So the Sandman is the point which is connected with the tranquilizing effect. So the tranquilizing effect also is working like a painkiller point. So this is the fifth number point. So in this way, we have learned the 5 point cingulate gyrus, then the thalamus, then the omega-2, then the point 0, and the final point is Sandman. So we already understood yesterday, and we also have seen the practical demonstration. I hope everything is clear, right? So 1, 2 on the hidden side, 3, 4, and the 5. With the help of these 5 points in both ear, we can treat all types of the acute and chronic pain. So this system is the battlefield acupuncture. Now, whether we have to do only the stimulation of 5 points, and why the 5 points? Why not the 6 point? Why not the 3 point? So I would like to tell you the concept behind this. So come here. So when there is a journey of the battlefield is started, so journey of battlefield acupuncture or the military acupuncture is started. Then the journey started only with the point number 1. Point number 1, that is cingulate gyrus. So in the mind of author, this concept was there, that whether the pain because of the emotional origin or the pain because of the physical origin, but ultimately the pain depends on the feelings, because you are feeling the pain, you are sensing the pain. Like we are sensing the emotions, we are sensing the different types of the emotions. We are sensing the sadness, worry, joy, happiness, depression, anger. In the same way, we are sensing the pain. So why not we treat the part of the emotional brain who is sensing the pain? Because when the anything is coming to your brain, when we are talking about the brain, and we are talking about your emotional brain, emotional brain is sensing the pain because we have seen many animals are having very poor emotions. They will not feel the pain that much. And even this has been discovered if the accidentally, 1 minute. So as per the author has seen, because author was surgeon, one person came to the clinic of author and the person got injury in the brain. And because of the injury, there were some injury to the cingulate gyrus. And after that, that person become fearless, no fear. Because of the accidental injury to the cingulate gyrus, the person was not having any pain. Like if someone was hitting the person was smiling. Even author has collected the data of many persons, because many persons are very rigid. Even we see in the central jail, they are very big criminals. Whatever you do, but they are not getting affected with your any actions. So author has done lots of research. What is the difference in this person which is making this person different from the other person? So found some person having some injury in the cingulate gyrus of the brain, so they have become fearless, no fear at all, no pain. So this concept he applied in the auricular acupuncture. Why not I should stimulate the auricular cingulate gyrus point? And as soon as he applied the cingulate gyrus point, just a single point, he suddenly see, wow, pain disappeared. So it means there is a very deeper connectivity of the cingulate gyrus with the pain management. So we can tell this was the combination of accidental discoveries plus the lots of input, lots of research done by the author or the Dr. Richard Nimchow. So after doing the treatment for many persons, he was just inserting the single point, cingulate gyrus, cingulate gyrus, cingulate gyrus to everyone. Suddenly he realized the ratio of pain relief just by 40%. Sometime more, sometime immediately pain relief, sometime less. Then he thought, what else we can do? Then out of research, he has seen the thalamus is the part of the brain who is affecting with the outer stimulus. Like if I am pinching here, oh, I am feeling the pain. So this is felt by the thalamus. If someone is doing like this, oh, lots of pain. This is impulses by the thalamus. If if the thalamus is damaged in someone, then again the same person is not responding with the outer stimulus, whether you pinch or you do something else. Then he has applied this second point, that is the thalamus. So in this way, the first point, who is making the person fearless, pain, no pain, and just a free from all the worries. And the second point, thalamus. So if we have got some pain because of the any outer stimulus, maybe because of the sports injury, maybe because of the accident, we fall down somewhere suddenly. So suddenly he got this thing in the mind. Okay, let's apply the second point, that is thalamus. So he used to do this treatment only for the person was in military. Okay, then after doing this treatment, so after completing the two treatment points, so this was the step-by-step journey. So first, cingulate gyrus, who is making person fearless, painless, no pain. And he has seen many patient accidental injury by the accidental injury of the cingulate gyrus, and the author has seen there is a no pain, the person was fearless. The second point, that is the thalamus. Thalamus is getting affected with the outer stimulus, all types of the outer stimulus, whether the pain or the temperature or any types of the outer stimulus. Now the ratio of the pain relief has reached significantly after adding the point thalamus. We can tell the ratio has improved till the 60%. So the meaning of 60%, out of 10 patients, 6 patients are getting relief. It is also a very good ratio. Then the Dr. Richard has seen the most of the people, whether the having pain in the muscles or in the bones, and in the human body, we are having 206 bones. Or maybe the pain will be in between the bone joint. Because right now, if we see our clinic, in our clinic, we are getting most of the patient coming in this category. Like someone is having knee pain, someone is having lower back pain, cervical spondylosis, shoulder pain. So most of the patient who is coming to our clinic belonging to this category. So author has so thought, why not I add some more point which can also work on all the muscles, all the bones, and each and every joints. So he has done research and found the omega-2. In our ear, we are having omega-1, omega-2. Omega-1 is just connected with the digestion. But the omega-2 is connected with all the muscular pain, all the skeletal pain, or the pain of the bones. So omega-2 is the great painkiller point, who is killing the pain, whether in the arm or in the leg or in the joint or in the bone or in the muscles. So third point he introduced, that was omega-2. Okay, so in this way, initially he was doing the treatment just by 3 point. Number 1, cingulate gyrus. And most of the people are getting relief just by single point. The second point was thalamus. 60% means very big range was curing by adding the thalamus point. Now the omega-2. After adding the omega-2, the ratio of the pain killing effect reached till the 65%. So finally, author has thought, when the person is coming to us, why not we balance the core of the human body? Because the person might be having misalignment in the body, maybe solar plexus is not on the place, so the person might be having some stiff muscle in this part, some loose muscle in the other part. So let's align whole body with the solar plexus, and for that he introduced the fourth number point, that was point 0. So ultimately he reached to the fourth point, that is point 0, and it has become a very, very wonderful protocol. Now finally Finally, author has thought the most of the people are too much stressful. They are not able to sleep, so suffering with the insomnia, and even because of the insomnia, collecting lots of stress in the muscles. So people are not having peace, no peace in the life, not able to sleep, too much stress, too much work, and people are just working, working, and working. Whether we talk about in the battlefield or in the military, they are working day and night, they are not able to sleep. So this stressful mental condition also creating the pain. So why not we add one point, who do the tranquilizing of the mind? So he added the fifth number point, that is Shanman. The meaning of Shanman, the gate of spirit. So finally, this has become a wonderful protocol of the 5 point, and the fifth point was Shanman. Now, with the help of this, we can make the person with no fear, no pain. We can treat the pain of all the muscles and the bones. We can do the good alignment of the human body, and also we can do the tranquilizing of the mind. So this protocol has become a wonderful protocol. So the question comes, why this thing is not coming in our mind? Because we are also, many of us are also doing a regular acupuncture. Many persons are doing the regular acupuncture since 2 years, since 5 years, since 3 years. So why not this concept or this type of the concept coming in our mind? Why? Just we are following what other people are telling. Only this is the reason. So sometimes why this thing is not coming in our mind, because we don't want to do new, or we just want to follow others. And sometimes discovery happening automatically, accidentally also. We are doing the treatment to patient, and suddenly patient is telling, you have added this point and I felt this. So automatically invention is happening. So when I was applying this battlefield acupuncture in my clinic, I have added few more points, and I have also got very good results. So I would like to share my personal clinical experience with all of you. So let's see now. So some additional point which I have applied to my patients. So I would like to discuss with you. If someone is having some problem in the head region, because there might be many problems happen in this head area or the brain area. Right now, my concern with the problem who is happening suddenly or the immediately, suddenly or the immediately, and affecting the head region, like seizures or the fits. As per our acupuncture science, the seizure is also the excessive wind in the head region, excessive air in the head region. And we also know the pathophysiology of the seizure. There is a plus energy in the head region as per our science. The suddenly person are having vomiting, sudden vomiting. Suddenly, if the person are having the problem in the movement, or the vision problem, or the hearing loss, any problem happening suddenly. So whenever any problem happening suddenly, we can consider this a sudden accident in that condition. What we are doing? This is the brain, this is a very big part. And when brain are ending, we can see here, you can look at me. So where brain is ending, that is called brain stem. So this is the brain stem part. This back side, so this is the cerebrum. And cerebrum is ending, then our stem is starting, that is called brain stem. So this is the part of the brain stem. This part is very sensitive. If you hit here, then person might die. This part is too sensitive. So karate champion, they are learning some special point here, because if you hit the medulla oblongata, if you hit the pons, if you hit the cerebellum, then the person will die on the spot, because here we have many points which are connected with, which are the points who are controlling our respiration, our breathing, and our all the internal activity. These structures are controlling. So if someone is hitting something here, or accidentally someone is collapsing down, maybe going with a bike, and suddenly after the accident getting injury here, so might suffer with a serious illness, even the person might die. So this is the part that is called brain stem. So brain stem can be considered the root of the brain. So let's see here. We can consider this brain stem. So this is the brain stem. This is the first part of the brain stem. This is the second part of the brain stem. This is the third part of the brain stem. After that, our cervical or the neck is starting. Okay. So this is the brain stem. This is the brain. And the brain stem is made by midbrain, pons or medulla, and it is just above the neck. So we can understand very simply, when any sudden problem arising in the human body, then we have to treat the brain stem. When there is sudden infections happening in the human body, sudden infections like the flu, like the COVID, like any types of the sudden infections happening in the human body, then anything which happens sudden, we have to treat this brain stem. So if we think accordingly, so let's come here. This is the area in the acupuncture. We are having one point here that is called governing vessel 16. The governing vessel 16 also, if we are stimulating the governing vessel 16, it is also stimulating the brain stem. And this point is directly connected with the medulla oblongata. So we are also telling this point as a MO point, or the medulla oblongata point. So we are not stimulating this point, but what I want to tell you, if some types of the infection happening suddenly in the human body, then we have to think about the brain stem. And this is available where our skull is ending and cervical is starting. So let's see here in the ear, if we see, so this is the location of brain stem point. So as per the auricular acupuncture, we can see here, this is the elevated part, and this is called antitragus. Antitragus. So AT means antitragus. And as soon as this antitragus is ending, then the antitragus, as per the auricular acupuncture, the antitragus is nothing but brain. So this is the brain, which I have shown here with the black color. Now, as soon as this antitragus is ending, this spine is starting. So this is the whole spine. So we can see this is the spine. Right now, we don't have to discuss about the spine. Just I am giving you one idea that this is the junction of brain and spine. So the junction of brain and spine is called brain stem. That is the point, brain stem. But again, I would like to tell you one more thing. This point is not located on this exposed side. This point is on the inner side, on the hidden side. So I will show you shortly in the 3D image. So when any types of the infection entering in the body, suppose someone is suffering with the attack of COVID virus or any normal flu virus. So as per the acupuncture, if we talk about the virus, if we talk about the bacteria, any pathogen attack, any types of the flu when they are entering in the body. So as per the acupuncture, we are telling them bind attack. So as per the acupuncture, whatever available in the bind, virus is available in the bind or air, bacteria available in the bind or air, pathogens also available in the bind of air. So these all are coming under the bind. So if I tell you virus attacked on the human body, but in the acupuncture language, I will tell you bind attacked on the human body, or pathogen attack on the human body, but in the acupuncture language, I will tell there is a bind attack on the human body. So when you are suffering with any types of the acute infections like the flu, we are telling there is a bind invasion, there is a bind attack. Then bind is going inside, means the virus is going inside, and when it is becoming the internal bind, then it is creating flu, coughing, fever, even convulsions, many different types of the problem. So suppose you were walking in the cold air and suddenly you are suffering with the sneezing, that is also bind. You were going in the hot air and now you are feeling too much heat in the body, that is also bind. And you have come in the contact of some person suffering with the flu and now you got the flu, that is also wind entered in the body, in your body. So in these all conditions, we have to stimulate the brain stem. So how to introduce this point in the battlefield acupuncture? So what we are doing, when we want to introduce any point in the battlefield acupuncture, we are placing this point on the 4th number. We are always placing this point on the 4th number. So what we'll do, the person is telling the doctor, yesterday I went outside and had the dinner outside, and also I have taken some cold drinks, and even the weather were cold weather, and from that time onwards I am having sneezing, some flu-like symptom, my body is aching, and also my legs are paining, arm are paining. So what we will tell, this is the sudden infections, the sudden entry of anything, that is called bind. So how can we introduce the battlefield acupuncture? So we'll start our journey with the Cingulate Gyrus. Cingulate Gyrus is very good for releasing the pain. Then we'll go to the next point, that is thalamus. The third point will be same, that is the omega-2. Now on the 4th number, we will introduce our new point, that is brain stem. Then on the 5th and 6th number point, our point will remain same, that is the point 0 and the Shenman. So in this way, we are adding some point and we are getting very fast result, very fast result. Because brain stem means we are doing a big control, because brain stem means bones, brain stem means medulla, and these all are connected with all the involuntary actions. So look at here. So brain stem means this bones, medulla, this whole part is coming in the brain stem, which is controlling all the involuntary actions. So we have to introduce this point on the 4th number, right? Now, initially, if some layman ask me, okay, I don't know acupuncture, tell me something very easy, which I can do myself. Then what I can suggest him, so I will tell no problem. You do one thing. You just want to remove the flu from your body. Yes, I want to remove the flu from my body. Okay. So what is flu? As per acupuncture, the flu is bind, or any invasion is bind. So just you have to do the acupressure all around on the hairline. So hairline is connected with the bend. Bend is doing invasion through the hairline points. Like we have seen here on the back side, we have brain stem. On here also we have some point who is allowing bend to enter in the human body. So just we have to massage with anything, even we can use the comb. So you have to massage all the hairline points. If you massage all the hairline point from front to back, so right now I am doing on the front side, I will do at least for 1 minute on the front side. And after completing 1 minute, then I will go on the side and I will cover the hairline at least for 1 minute. Then I will go other side and will cover the hairline and at least I will do for 1 minute. Then I go on the back side and I will also stimulate the back hairline and I will do the stimulation for 1 minute. So this is a very good point. This is called the mention of bend. This is called the pool of bend. So these are the name of point. This is the mention of bend. This is the pool of bend. If we do the massage on these point, we can expel the wind, we can expel the fluid. So in this way, in the auricular acupuncture, the same action, what we have done with the help of this, we can use any other object like the comb. In the auricular acupuncture, we are doing the same thing by adding the point that is brain stem. So let's see here. So we have to add this point that is brain stem. So we have to add this point here. So now I would like to show you the location of this point, only 1 minute. So you can understand the very clear location of this point. Brain stem is connected with all types of the viral infections, bacterial infections. Let's see. If someone is having sudden convulsion, seizure attack, or epileptic attack, so this is also bend. If someone is having suddenly severe migraine headache, that is also bend. So let's see here. So you can see in this image. So if you look at this image, so you can see here. So this is the brain. This is the brain, right? And in the acupuncture, this is called AT or the antitragus. Antitragus. Then after the antitragus, this next part is the spine. So this point is located on the junction of this, the antitragus and the spine, but not on the exposed side, but on the hidden side. So let's go and see on the hidden side. See, you cannot see the point right now. Right now, it's not visible. But as I go inside, you will see now this point is visible. Now you can see. On the inner side, this point is visible. So this brain stem point is located on the inner side, right? So we have to reach on the junctions. So we have to reach on this junction. Then we have to see this point. Now, sometime we are putting the point here. Why mistake? Sometime putting the point here, here. So this cannot be considered as a brain stem because this point can be considered as a occiput. This point is occiput. The meaning of occiput, the ending of the brain and starting of the spine, the junction is occiput, means this part is occiput. The external exposed part is occiput. So also remember occiput, because shortly I will also tell you the benefit of this exposed point, that is occiput. We will also discuss this point shortly, right? So first I will like to show you the practical demonstration of both the points. Then I will tell you few more things about these both the points. So look at here. So now you can see the ear. Is it visible properly? Okay, fine. So now I would like to tell you the location of both the points one by one. One is the occiput and second is the brainstem, because both points are very much useful. So let's see here. So if we look at this is the part, this is called brain. This is called brain, right? And this is the spine. Then we can see the junction of brain and spine here. This is the junction of brain and spine. So if I'm putting the one seed here, suppose I'm putting one seed here on the junction, on the just junction. So whether this is the brainstem, so answer no. This is occiput, because when brain is ending and this spine is starting, so this is the occiput, and even you can see we can put the needle here. So this is the occiput. You can see this is the needle. So if we talk about the brainstem, then we have to go inside. The occiput is located, sorry, the brainstem is located on the inner side, on the hidden side. So we have to go inner side here. So from this point, we will drop down. We will drop down and we'll go in the bottom, and this is the point, that is the brainstem. So brainstem, for the brainstem, from this junction, we will drop down and we'll go in the bottom. Then we will put the point on the wall, that is the point of brainstem. So this brainstem is very wonderful point. We can add on the 4th number location with the battlefield acupuncture, and with the help of this brainstem, we can expel the wind, expel the viral infections, bacterial pathogen infections, any types of the invasion, just by adding this point on the 4th number location. So with the battlefield acupuncture, we can work on the pain of the arm, of the leg, even on the fever. So this is a very wonderful point. So by mistake, if you are putting the point here, then this point will be considered as a occipital point, occiput. Okay. So right now I would like to show you a few more things. So we'll discuss all other thing altogether. If we look at the ear, so this is the outermost rim of the ear. We can see this is the outermost rim of the ear. This outermost rim of the ear is called helix. The name of this part is helix. So for learning purpose, we have divided this helix like helix 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So we have divided this whole outer rim part in the 15 equal part. So helix 1 to helix 15. Right now, we are not going to discuss all the 15 part, but I would like to bring a focus here. So look at this part. You can see this part is little different. This part is little elevated. We can see this part is little elevated, and the name of this part is Darwin tubercle. Remember, the name of this part is Darwin tubercle. So, 1 minute. 1 minute, 1 minute, 1 minute. So this part is called elevated part. This is called Darwin tubercle. I will put one tap here. You can see in your ear, everyone having this elevated part here. This part is called Darwin tubercle, or in the auricular acupuncture, we are giving the name 11 number, because helix 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So we are giving this point as a number 11, right? So right now, just remember the number 11. Then finally, if we go down, we are reaching in the last of this helix. So here we are giving the 50 number. So just my intention to bring your focus, we are telling it 11 number and we are telling it 15 number. So 11, 12, 13, 14 and 15. In that way, we can divide 11 to 15 in the equal part. So if I tell you, okay, put the point on the helix 14. Okay, so this is the 15 number and this is the 14. So I can put the point here. See, this is the helix 14, right? So just remember this concept, because shortly I will also discuss something with you about this helix 11, helix 12, helix 13, helix 14 and helix 15. Only 11 to 15. That's it. Nothing else. Okay. That time I will not do the practical demonstration. So I am doing this practical demonstration right now. Okay. 1 minute. So look at here. So we have seen the point brain stem. Brain stem point is the point who is hidden inside. Okay, so this point will not be in the exposed side, but this point will be on the inner hidden side. We already seen. And when to use this point? We will use this point if there is a viral infections, pathogenic infections, flu, coughing, fever, or convulsion, seizure, migraine, something happening in the brain and looking like too much wind. So the first point will be cingulate gyrus. Second point will be thalamus. Third point will be omega 2. Fourth point will be about this brain stem. The fifth and sixth point will be in the same sequence. That is the point 0 and the Shenman. Right. Now I'm moving ahead. Now we are coming to this occiput point. I told you by mistake we are putting the occiput point, but occiput point is also doing the same thing what is done by the brain stem. Whether we talk about the occiput or the brain stem, both points are where our skull is ending and the cervical is starting. So this occiput point is also very, very good if you want to dispel any types of the bend, internal bend, or something happening suddenly in your head area. So ultimately we have to treat this area only where our this head is ending and spine is starting. So the indication of the occiput will remain same. So what will be our protocol? Cingulate gyrus, thalamus, then the omega 2. Now on the fourth number, we will introduce other points like the brain stem and the occiput. Then the remaining point 0 and Shenman will remain on the same place. With the help of this, we can expel any types of the infections from the body. Now we already learned the location, so we can do very properly, very nicely. So let's go ahead. Is it clear to everyone? Any confusion till now? Anyone having any types of the confusion till now, or everything is clear? Whether everything is going easy or little difficult? Everything is easy. Okay, clear. Fine. So brain stem is, for the brain stem, we have to go on the base. Thank you. So let's go ahead. So Now we will move to the next thing, but before proceeding for the next thing, I would like to tell you on the next week, on the same time, on the Monday and Tuesday, we will do the free workshop on the NADA protocol, and where we will learn how to work on the de-addiction using auricular therapy. Not only the NADA protocol is not only we are using for this purpose, but the NADA protocol is also very good for the stress, for the anxiety, and for the insomnia. Even if you have learned earlier, then also this today's workshop will be beneficial for you because we have to learn some deeper concept. So on the next week, we will discuss NADA protocol. NADA means the protocol for brain, for anxiety, for stress, for insomnia, and for de-addiction. Whether the addiction of the tobacco, alcohol, drug, marijuana, any types of heroin, any types of the addiction, we can work with the help of NADA protocol. So next Monday and the Tuesday, we will be having on the same time, means 3 p.m. onwards, right? So one more information, if anyone want to learn the auricular therapy in the detail, so the new concept we are starting from tomorrow, means Wednesday, tomorrow, 4:30 p.m. onwards. So our class will be on the alternate day. And this will be near about 30 session class. So 30 session will go near about 2.5 months, more than 2.5 months. And we will learn the each and every disease, the treatment of the each and every disease using the auricular acupuncture. So if anyone want to enroll, you can WhatsApp me at this number. So I will give you more information, right? So now we are coming back here. So if we see the ear, just I have demonstrated you, this is the helix or the outer rim of the ear. So this is the helix or the outer rim of the ear, and we have divided this helix from helix 1 to helix 15, right? So here will be helix 1 and here will be helix 15. We have divided this whole part in the 15 equal, we cannot tell equal, but 15 parts. Now, if you see here, this part is little elevated. So this elevated part is called Darwin tubercle. This elevated part is called Darwin tubercle because the discovery of this point is done by scientist Darwin. So this is called the Darwin tubercle, and everyone is having this Darwin tubercle in our ear. Someone is having bigger and someone is having smaller. So in the auricular acupuncture, we have given in the sequence because there is helix 1, helix 2, 3, 4, 5, 6. So the number of Darwin tubercle is 11 number. Okay. So right now, just remember the Darwin tubercle and forget everything else. So just remember the Darwin tubercle, the number is 11. And this is the last part of the helix, the number is 15. Okay. Then we have 12, 13, 14, right? So we can tell helix 11, helix 12, helix 13, helix 14, and the helix 15. In this way, we can divide this 1, 2, 3, 4, and the 5 area in your ear. So we can see also in the other ear. So this is the area 1, area 2, area 3, area 4, and area 5. From the helix 15, from the helix 11 to the helix 15. Now we are going to discuss a very beautiful thing. That's why I already demonstrated you and I have told you that we can put the needle here. If I tell you put in the helix 15, or we can put the seeds. So before I proceed, I would like to ask you whether you are able to search this point in your ear or not. Whether you are able to search Darwin tubercle in your ear or not. So kindly touch the Darwin tubercle, try to find out and give the number 11. Give the number 11, and here you can give the number 15, right? So 11, 12, 13, 14, 15. Kindly search. And those who are not able to search, you can take the help of someone, see in the mirror and try to find the elevated part. That is the Darwin tubercle. Everyone having this Darwin tubercle, even if I see my ear, in my this ear, it is very clear. But in this ear is not that much clear. It is, I have to search. I have to search in this ear, but in this ear, it's absolutely clear. We can see the Darwin tubercle here, right? So there is a no fixed distance from the, but Darwin tubercle itself is clearly visible. No need to think that how much distance from the ear apex, because if you see my ear, you can see the clearly elevated part here. That is the Darwin tubercle. It's clear. It's visible here. You can see. It's visible or not? Tell me. Even suppose I am patient, I am coming to you. You want to search my Darwin tubercle. So it is visible or not? Tell me. Visible. So what is the number of Darwin tubercle? Tell me. What is the number of Darwin tubercle? 11. And what is the end point of this helix? Tell me. 15. So everyone is understood 11 to 15. Now we are going to see very wonderful thing given in the auricular acupuncture. So look at here. So this is the 15, 14, 13, 12, 'Okay, now. So as per the auricular acupuncture, our body is in the inverted posture. So this is the brain. This is the cervical spine. Cervical spinal cord. This is the thoracic spinal cord. Thoracic spinal cord. This is the lumbosacral spinal cord, and this is also the lumbosacral spinal cord. Lumbosacral spinal cord and the lumbosacral spinal cord. So remember once again, if you are treating the helix 15, you are treating all the brain disorder, all the psychosomatic disorder. If you are treating the helix 14, you are treating the cervical problem, the pain of the cervical, the pain of the cervical spondylosis, any problem happening because of the cervical problem. If you are treating the foot 30 number area, you are treating the thoracic area. And the 12 and 11 are lumbosacral junction, means lumbar means lower back, and the sacrum junction. So just by using this small area, you can treat whole spine, especially my focus here about the spine. Now suppose someone is having the problem of the cervical spine, how to do the treatment. So we will start our journey with the number 1 point, that is cingulate gyrus. Number 2 point, that is thalamus. Number 3 point, that is omega 2. Number 4 point, we will add, if the patient is cervical patient, we will add the cervical point. Then the 5th and 6th number, we will add the same point like 0 and the Shenman. So in this way, battlefield acupuncture will become more efficient and we will see very, very excellent results. So this was the, now we can see in this image. So in this image, we can see, so this is the helix 15, or B means brain. So look at it, this is the B means brain. And this is the helix 14, or the cervical. Then we can see thoracic, lumbosacral, and the lumbosacral. So in this way, you can treat whole spine, the brain and spine, brain, cervical, thoracic, lumbosacral, and the lumbosacral. And how to do the needling, I already demonstrated you, or you can put the seats here. So in this way, we can treat here. Now there are many things to learn. sciatica pain and the teeth pain, but we have limitation of the time. So we are closing the session now. Now we will keep on discussing the further many things of the battle acupuncture from tomorrow onwards in our regular session. And tomorrow onwards, we will continue the discussion on the battle acupuncture in our regular class for the enrolled participant. But I think this much information also will give you very good thought that how to do the battlefield acupuncture for the patient suffering with many different types of the disorder. So thank you so much, everyone. Now we will do the break for a few minutes, then we'll do the recap in Hindi. तो अभी पूछना चाहता हूं कि अगर किसी के मन में कोई प्रश्न है तो हम 5-6 लोगों से 2-3-5-6 लोगों से हम बात कर सकते हैं अभी. If anyone having any types of the query what we have discussed today, किसी के मन में कोई प्रश्न है तो बताइए. Anyone having any questions? ये रक्षा जी, yes please unmute yourself.
Sir, ये very good session. Actually, I'm interested for this proceed like next session also.
Yeah.
मुझे ये पूछना था कि this is the omega-2 point. Is it good to apply for the patients who is having a lower back pain, जिसका like continuously बैठने से एक साइड का डिस्क का जो हड्डियों का पार्ट है वो ऐसे थोड़ा सा टिल्ट हो गया हो, दब गया हो. So is it okay for the pain relief?
Yeah. So because हड्डी की बात है ना, तो हड्डी के लिए तो जरूरी है, क्योंकि हड्डी दब गई है. अगर मसल्स का पेन है, मसल स्पाज्म में चली गई, तो ओमेगा 2 तो लगाना पड़ेगा. ओमेगा 2 इज वेरी गुड पॉइंट फॉर मस्कुलो स्केलेटल प्रॉब्लम. सो मस्कुलर प्रॉब्लम एंड द स्केलेटल प्रॉब्लम तो हमें लगाना ही पड़ेगा. इट्स मैंडेटरी. Omega 2.
Okay, sir. Okay. Thank you, sir. Sir,
Well,
please share the details for coming classes.
Yes.
Yeah.
I will share. Yeah.
Yes, thank you.
Welcome. Yes. Unmute yourself, Anuji.
Sir, for general, just for seizures, can we directly use the point brainstem?
Yes. We can put for the seizure, yeah. Because see, but for the seizure, if the person, like I told you, when there is a wind invasion, you can just put 2-point occiput and the brainstem, even it is going to work partially. Definitely, yeah. You can do that.
Okay, so for only for seizures, we don't have to put this whole protocol. Only
No.
brainstem.
What I'm telling you, if the person is getting seizure suddenly and having lots of heaviness, pain in the head region, then whole protocol is also very good, because in this protocol we have thalamus point, which is also a very good point, and cingulate gyrus is the point of the emotional brain. If you put a whole the complete combination, then it's really good. Yeah.
Okay. Thank you.
Yeah. One more thing I would like to tell you, there is a few contraindication limitation to this acupuncture. So I didn't get the time, so I will put the PDF in the group. In that PDF, there is just some limitation and the contraindication. So kindly go through with that also, and then you start the treatment, right?
Yeah,
क्योंकि हमने कुछ चीजें अभी डिस्कस नहीं किया कि क्या contraindication है, किसको करना है, किसको नहीं करना है. So I will put the PDF in the group. So kindly go through with the PDF. I will put in the PDF in all the 3 battlefield group. Okay. Yeah. Yes, Raji. Yes, please.
Hello,
Raji.
good evening, sir.
Very good.
Sir, if the patient is having pain in L3, L4,
Yeah.
should use the point helix 12 or 11?
Both. L1, L2, L3. L2. So the thing is this, if the problem in the lumbar area or the sacrum area, you use 11, 12 both. The reason is this, because the Darwin tubercle itself, we are treating for the lumbar pain. Only the Darwin tubercle also very good for the lumbar pain. So if we use both the point, whether the problem only in the lumbar or only in the sacrum or the sciatica or in the complete area, kindly treat both the points, 11, 12. Both.
11, 12 using in the 4th position, sir?
Yeah. 4th position, what means?
The sequence of battlefield.
Yeah, 4th position. Yeah, you're right. Yeah, 4th number. Yeah, you're right. Yeah.
Thank you, sir.
Yes. Yeah. Selvaji, yes, please.
Thank you, sir. Very good session, sir. Sir, there is a pain. If there is a pain because of nerve compressions or disc slip or disc prolapse, in such area also this is useful, or because
Yeah,
this is pain.
so definitely we are searching that type of patient. If the patient because of the nerve compression, because we want to treat inflammation. If there's a nerve compression, it is creating the inflammation, pain, redness, swelling. So our intention to work and remove that inflammation, and that's why we are using this whole combination. Thalamus point is very wonderful for releasing these types of the inflammation. So we will definitely use, yeah.
This will, we can work on that.
Yeah.
Okay, sir. Okay.
Kanadji, yes, please. Kanadji.
गुड इवनिंग सर.
Very good.
सर ये जो सिंगुलेट वायरस इनको एक स्पेसिफिक मैनर में अपन लगाते हैं पॉइंट्स को, तो इज देयर एनी स्पेसिफिक रीजन फॉर इट?
Yeah, because the author has started the journey of battlefield acupuncture just with a single point. First, that was the cingulate gyrus, and as per the author, cingulate gyrus single and alone point is enough for many patients. केवल एक पॉइंट ही काफी है कई पेशेंट के लिए. तो उनका कहना था कि पहले सिंगुलेट गायरस से स्टार्ट करो, क्योंकि सिंगुलेट गायरस इतना इफेक्टिव होता है कि कभी कभी इसको लगाने मात्र से पूरा दर्द चला जाता है. अब आपने मान लो थैलेमस लगाया, फिर आपने सिंगुलेट गायरस लगाया, लेकिन दर्द तो सिंगुलेट गायरस से ही गया, तो क्यों ना हम सिंगुलेट गायरस को ही लगाएं, क्योंकि 50% पेन जस्ट गो विद द सिंगुलेट गायरस. सो ऑथर हैज स्टार्टेड. Initially, he was using just a cingulate gyrus, not any other point. Then gently he has invented the.
ओके ओके ओके. और सर अभी आपने जो बताया, जैसे जो 4th नंबर पर लगाएंगे अपन, जो भी एक्स्ट्रा पॉइंट अगर अपने को लगाने हैं तो दैट वी हैव टू पुट ऑन 4th नंबर.
यस यस
सर, ऐसा क्यों?
ऐसा इसलिए कि पहले हमने जैसे सिंगुलेट गायरस का लगा दिया तो वो सारे दर्द को कम कर देगा इमोशनल लेवल पर और हमारे लिम्बिक ब्रेन के लेवल पर, और थैलेमस बॉडी के लेवल पे कर देगा. तो हमने अपने मन के लेवल पे भी काम कर लिया, बॉडी के लेवल पे भी काम कर लिया. अब ओमेगा 2 क्या करेगा कि 206 हड्डियां और मसल के पेन को भी गायब कर देगा. तो हमने लगभग सब काम तो कर लिया. अब हम लोकल अप्रोच अपनाएंगे. अब लोकल अप्रोच का मतलब है कि सर्वाइकल की बात है तो अब सर्वाइकल का लगा दो, कमर की बात है तो अब कमर का लगा दो. पहले हमने लोकल अप्रोच नहीं अपनाई, पहले हमने यूनिवर्सल अप्रोच को अप्लाई किया, होल बॉडी. ओके. किसी ने कहा कि उसे सिर में दर्द हो रहा है. अब सिर में दर्द तो पेट के कारण भी हो सकता है, सिर में दर्द तो बीपी के कारण भी हो सकता है. तो पहले हम होल अप्रोच अपनाते हैं ताकि पूरी बॉडी बैलेंस हो जाए, फिर हम लोकल अप्रोच पर जाते हैं. हर ट्रीटमेंट में ऐसा ही करते हैं. इवन इन द टीसीएम पहले हम होल प्रोटोकॉल बनाते हैं, फिर लोकल पॉइंट लगाते हैं इन द लास्ट.
तो सर इसको 6 नंबर पर भी रख सकते थे ना?
नहीं, क्या होता है कि फिर क्या होता है कि जो लास्ट के 2 पॉइंट्स हैं वो तो एक समझिए कि कहते हैं ना कि जब हम प्रार्थना करते हैं, जैसे आपने योगासन किया है ना, तो योगासन में आप क्या करते हैं कि आप पहले पूरा योगासन करते हैं, फिर लास्ट में क्या बोलते हैं, ओम शांति शांति शांति. तो हम आर्गुमेंट कर सकते हैं कि हम ओम शांति शांति बीच में बोल दें. तो अभी आपका 40 मिनट का सेशन है, अभी 20 मिनट हुए हैं, अभी हम शांति 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 बोल देते हैं, फिर हम 20 मिनट और कर लेते हैं, लास्ट में नहीं बोलेंगे. तो ऐसे ही होता है. शैनमैन मीन्स शांति ही शांति ही शांति ही. शैनमैन मीन्स नाम है शैनमैन, द ट्रैंक्विलाइजिंग पॉइंट. सब काम हो गया, अब शांति. इसलिए शैनमैन लास्ट में आता है और उसके पहले पॉइंट 0 आता है. पॉइंट 0 भी क्या करता है कि आपने सब काम तो कर लिया बट कोर को बैलेंस करता है, तो इट इज बैलेंसिंग द कोर. इसलिए शैनमैन तो लास्ट में आएगा और उसके पहले हम पॉइंट 0 लगाते हैं.
सर निडल जो इंसर्ट करते हैं, सर कितना इंसर्ट करते हैं उसको?
निडल बहुत सुपरफिशियली इंसर्ट करते हैं, लेकिन कितनी जाएगी हम, मतलब निडल स्किन के ठीक नीचे ही रहती है. निडल को बहुत लंबा, मतलब निडल को बहुत हम कार्टिलेज को पेनिट्रेट नहीं करते भी. हम सिलेंटिंग मैनर में लगाते हैं. सिलेंटिंग मैनर में हम अगर सुजोग है तो पूरी भी डाल सकते हैं, लेकिन सिलेंटिंग में है ना.
स्लैंट में कितना स्लैंट करते हैं उसको?
15 से 20
डिग्री का एंगल नियर अबाउट
15 से 20 डिग्री.
ओके सर, ओके सर.
हाँ,
थैंक यू सो मच सर.
जी वेलकम.
तो सेशन बहुत अच्छा था आपका.
थैंक यू सो मच. यस नैना जी.
Hello.
हेलो नैना जी.
हाँ sir, is there is a acupuncture point for a hair problem like graying of hair or hair loss?
Yeah, that will be discussed in the class, because this class just for the battlefield acupuncture.
Okay. Thank you, sir.
Okay.
Give me details, sir, please.
Yeah, sure. I will give in. Yeah. So you can send me message. I will send you that. I will give you the detail. Yeah. Yes, Sumit ji.
सर मुझे पूछना था अभी जो आपने हेलिक्स 15 बताया ब्रेन के लिए,
हाँ,
तो क्रॉनिक ब्रेन की प्रॉब्लम्स में भी वो वर्क करेगा?
किसमें?
क्रॉनिक जो पुरानी ब्रेन की डिसऑर्डर्स हैं उसमें वो वर्क
एक्चुअली
करेगा?
क्या होता है कि वो जो मैं आपको बता रहा हूँ कि आपने सुना होगा कि जो हेरिक्स 15 नंबर का जो पॉइंट होता है, अगर आप ऑरिकुलर की प्रैक्टिस करते हैं तो आपने सुना होगा कि उसे हम बोलते हैं द पॉइंट ऑफ सेक्सुअल कंपल्सिव डिसीज, है ना। जब किसी को पोर्नोग्राफी में बहुत एडिक्शन होता है, जब किसी को साइबर सेक्स में बहुत एडिक्शन होता है और उसके माइंड में हमेशा इस तरह की बातें चलती रहती हैं, हाइपरसेक्सुअलिटी का पॉइंट कहलाता है। सो एवरीथिंग अबाउट द माइंड, दैट इज द हेलिक्स 15. Everything about the brain, everything about the mind, that is helix 15. So helix 15 is directly connected to the brain, definitely with very, very, very chronic problem. Not only very recent, very chronic problem.
Okay, sir. Okay,
Yeah.
thank you.
Yes. Parminder ji, yes please. Unmute करिए, परमिंदर जी unmute करिए। जी।
सर नमस्कार सर।
नमस्ते परमिंदर जी।
सर ये जो पेन है अगर किसी को, तो पेन के केस में तो हमें पता लग जाएगा कि पहला पॉइंट लगाया, फिर दूसरा लगाया, फिर तीसरा लगाया। जब पेन कम हो गया तो हमें पता लग गया कि हमें कौन से कान को यूज करना है आगे। तो ये सेम मेथड इसमें भी चलेगा? अगर हमने बीच में चौथा पॉइंट आपका अलग से लगा दिया ये वाला, तो ये भी उसी तरह रहेगा कि अगर राइट साइड के कान में फर्क पड़ेगा तो फिर लेफ्ट को यूज नहीं करना, फिर राइट में रखना?
बिल्कुल वही मेथड जाएगा, सेम। अगर आपने जैसे आपने अगर तीसरे नंबर का पॉइंट लगाया, उसको फर्क पड़ गया, तो जिस कान से फर्क पड़ा सारे पॉइंट उसी में लगेंगे।
तो जो हम ये चौथा ऐड कर रहे हैं,
हाँ,
इस केस में भी यही रहेगा मेथड?
हाँ बिल्कुल बिल्कुल, मेथड बिल्कुल वही रहेगा, कोई चेंज नहीं होगा इसमें।
दूसरा सर, पेन के केस में तो हम कह सकते हैं वो बता देगा अपने आप कि हाँ मुझे फर्क पड़ गया, अब हमें यही कान आगे लेके जाना है, दूसरे को यूज नहीं करना।
हाँ।
लेकिन कन्वर्शन है, उसको इन्फेक्शन है या फीवर है, उस केस में क्या करेंगे? वहां तो पता लगेगा नहीं इमीडिएटली।
हाँ, कुछ देखो हमारे पास दोनों तरह के केसेस आते हैं कि कुछ केसेस में तो तुरंत पता चलेगा और कुछ केसेस में तुरंत नहीं चलेगा। अब कुछ में नहीं चला तो अपने को फिर अगले दिन तक का तो वेट करना ही पड़ेगा। हमारे पास कई ऐसे पेशेंट, हाँ तो हाँ, अगर बिल्कुल पेशेंट डेफिनेटली फिर दोनों कान में लगा देना पड़ेगा। अगर हम बहुत सारे पेशेंट तो आज ऐसे ही आते हैं कि वो रिस्पॉन्ड ही नहीं करते हैं, मतलब हम पूछें अभी कैसा है, अभी कैसा है, अभी कैसा है, तो उनको भी बड़ा, क्योंकि पेशेंट को कैसा डॉक्टर चाहिए जो खुद अपने विवेक से पॉइंट लगा दे, है ना। आप पूछोगे अभी कैसा लग रहा है, अभी कैसा लग रहा है, अभी कैसा लग रहा है, तो पेशेंट के मन में बात आती है कि भैया तुम डॉक्टर हो ना, तुम देखो ना तुमको क्या लगाना है, हमसे क्या पूछते हो, और यू आर द बेटर जज। तो फिर क्या होता है, कई पेशेंट फिर हमें क्या होता है कि हम पूरे पॉइंट लगा देते हैं। बहुत सारे पेशेंट, करीब 50% पेशेंट को तो पूरे पॉइंट ही लगा देते हैं। 50% पेशेंट में हम ये करते हैं कैसा है कैसा है कैसा है, तो पूरे लगाते हैं। तब हमें कई बार फीडबैक उस दिन नहीं मिलता, कई बार फीडबैक हमें अगले दिन मिलता है, अरे कल बहुत अच्छा था, ऐसा बोलते हैं लोग।
ओके, थैंक यू सर।
ये डॉक्टर जितेंद्र मंडल जी, यस प्लीज।
अजय, गुड आफ्टरनून सर।
वेरी गुड आफ्टरनून डॉक्टर।
मेरा एक टेक्निकल क्वेश्चन है। टेक्निकल, मैं एकदम नया हूँ आज के सेशन में, कल भी प्रेजेंट नहीं हो पाया। तो मैं पूछ रहा था सर, अगर मैं ये सेशन जो आपको जो क्लास दे रहे हो आप, वो अगर हम ऑनलाइन देते हैं, उसके बाद तो ह्यूमन टच तो हमें नहीं मिल रहा है, तो ये कुछ दिक्कत नहीं होगा पूरा सीखने में? मुझे कोई नॉलेज नहीं है एक्यूपंक्चर के बारे में, अगर प्रैक्टिकल कहाँ से मिले?
हम जो कोर्स करवा रहे हैं ना, वो हम बिल्कुल जीरो से करवा रहे हैं, एकदम जीरो से।
हाँ तो सर टचिंग फीलिंग नहीं है ना, पॉइंट वाला आप दिखा रहे हैं स्लाइड में, ठीक है, समझ आ रहा है थ्योरेटिकल, लेकिन जो प्रैक्टिकल सेशन चाहिए।
हाँ, क्या होता है कि हमारे दिमाग में भी ऐसा था जो आप बोल रहे हैं, लेकिन जब 2 साल में हमारे दिमाग से ये बात निकल गई, 2 साल पहले हमारे दिमाग में भी ऐसा था कि ऑनलाइन कैसे सीखेंगे, ऑनलाइन कैसे सिखाएंगे, लेकिन आज वो बात खत्म हो गई। मैं आपको बता रहा हूँ कि जब हम लाइव क्लास करते हैं ना, तो लाइव क्लास में क्या होता है कि एक मॉडल होता है, उसका कान दिखता है, और जैसे मॉडल लेटता है ना, तो 5 लोग आके खड़े हो जाते हैं। वैसे भी 10 लोग पीछे खड़े रहते हैं, फिर ऐसे करते हैं, ऐसे करते हैं, उनको दिखता ही नहीं है। उससे तो अच्छा ऑनलाइन में मैंने कान के ऊपर फोकस कर दिया। आप भले ही नेपाल में बैठे हैं या यूएस में बैठे हैं, आपको सिर्फ कान ही दिख रहा है, आपको कान दिख रहा है। अब रही बात ये कि देखो सब चीजें टेक्निक से होती हैं, तो ये हमने देखा है कि बहुत सारे लोग जो मुझे कभी मिले भी नहीं है, उन्होंने सीख लिया और 2 साल के अंदर ही सीखकर उन्होंने आजकल एक दिन में 6 से 7 पेशेंट को हर रोज ट्रीट कर रहे हैं और वो भी बहुत सक्सेसफुली। तो आप ऑनलाइन भी बड़े आराम से सीखा जा सकता है, ये हमने देख लिया है, इसमें कोई भी इशू नहीं आता है। फिर अपने दिमाग पर है, कई लोग, हम कई बार जैसे हमारे पास कई लोगों के फोन आते हैं, ऐसे 100 में से 1-2 ही लोग होते हैं, वो उनको लगता ही नहीं कि ऑनलाइन सीख पाएंगे कभी, तो हम फिर उनको बोलते हैं भैया वेट करो, फिर जब पेंडेमिक शांत होगा तब सीखना। लेकिन 98% पीपल आर एग्री कि ऑनलाइन भी खूब बढ़िया सीखने को मिलता है। और इसीलिए मैं पहले तो आपको 5-6 वीडियो देता हूं कि चलो भाई देख लो, अगर आपको समझ में आएगा तब ये डिसाइड करो कि हाँ ऑनलाइन ही सीखना है, नहीं तो फिर आप वेट करो, जब पेंडेमिक शांत होगा तब लाइव क्लास की जाएगी, है ना। मेलेनी मोरविजी, यस प्लीज।
Yeah, hello.
Hello.
Thank you very much for the great session. It was very informative. Thank you.
Yeah.
Just asking,
Yeah.
Battlefield Acupuncture, does that work for any pain? So I could, if someone has knee pain, I can just put the knee point on the fourth, just stimulate the knee point at the fourth point.
Yeah.
And same
yeah. Okay. So you're asking that if the person is suffering with a knee pain, so just if we put the fourth number point only, you're asking that?
No, if it's just, can I?
Yeah, got it.
Any pain, for any pain in any body part.
Any pain. So in the battlefield acupuncture, you can put that local point on the fourth number. You are right. Yes, definitely.
Okay.
Yeah.
Oh, that's very good then. Oh yeah, thank you very much.
Yes, most welcome.
And would you put more information about your course in the group, in the WhatsApp group?
Yeah, sure. So if you are in the group, so I will send you there. I will send the information in all the 3 groups. Okay.
That's brilliant. Thank you very much.
Most welcome. Yes. Is Lokpal ji? Yes, please. Lokpal ji. Lokpal ji, unmute yourself. Yeah.
सर नमस्ते सर।
हाँ नमस्ते लोकपाल जी।
हाँ सर, ये जैसे आपने अभी बताया था, तो ये कोरोना और नोजी में अगर होगा तो ये कौन सा कहाँ पे लगाना पड़ेगा सर?
ब्रेन स्टेम और ऑक्सीपुट।
50 नंबर?
नहीं, वो जो हमने बताया था ना कि ब्रेन खत्म होता है, स्पाइन चालू होती है, जंक्शन,
जी
वो लगाना होगा, वो मुख्य बिंदु है। जो हमने हेलिक्स पर बताया था वो तो हमारा that is the point of cervical, thoracic, lumbar, उसका है वो। हाँ ठीक है।
और ये पीडीएफ कब देंगे सर? और दोबारा मुझे
पीडीएफ मैं डाल दूंगा, आज रात को डाल दूंगा। अभी मेरी कंटिन्यू क्लास है रात को 10 बजे तक, उसके बाद में पीडीएफ डाल दूंगा।
तो ये फिर अगला, फिर वही सोमवार और मंगलवार सेशन होगा सर अगला?
हाँ, वो अगला दूसरा सेशन होगा। बाकी जो इनरोल पार्टिसिपेंट है उनकी तो क्लास रोज चालू रहती है ऑरिकुलर की, तो जो इनरोल लोग पार्टिसिपेंट उनकी क्लास तो कल भी होगी, उनकी क्लास मंडे, वेडनेसडे, फ्राइडे होती है, तो उनकी कल भी होगी क्लास। बाकी अब हम फ्री सेशन करेंगे मंडे, ट्यूसडे को, तब आप ज्वाइन कर सकते हैं। ठीक है।
ओके सर
जी
ठीक है, थैंक यू
जी। ये सागरी राघवन जी, यस प्लीज।
Good evening, sir. I just, in continuation of yesterday about the seeds, the ready-made seeds which are there in the pad which you showed us, that can be kept on for 7 days, is it, if there is pain?
Yeah, so I will tell you, when we talk about the battlefield acupuncture, the Dr. Richard were using ASP needle. ASP. This needle is not available in India, but a few person are telling that they might be having this needle. So I'm asking them because I am getting this needle from the US. Okay. And or some of my friends coming from the Germany, so I'm getting this needle from them. This needle is very, very specialized needle, ASP. And if you put in the Google, then you will see the ASP needle. When we put the ASP needle, they get very nicely stuck inside. Okay, but we don't have that. No problem. You can use this Baccaria seeds. So Baccaria seed also very good, and we can put them for 7 days. But patient might tell you, oh doctor, on the 3rd day, my 1 or 2 seeds are falling down. This might happen with this Baccaria seed because these are seeds, and that is the needle. Needle are sticking inside, and until and unless we remove it, they will not fall down. But this Baccaria seed might fall down, and even you can use any types of the needle. If you are giving the treatment in a clinic, you can use the normal acupuncture needle for 30 to 40 minutes and you can remove it, right?
Thank you, sir.
Welcome. Yes, Srinivasan ji. Srinivasan ji. Unmute, unmute, unmute.
Send me the details.
Yeah, sure. Srinivasan, yeah. Yeah, Sumul Goyek ji. Unmute once again.
Just want to check with you, the brainstem, is it on the wall of the anti-tragus, or is it at the base, on the base of the anti-tragus?
It is on the hidden side, on the base, not
on the base, not the wall.
No. On the wall, but on the hidden side.
Yeah, until the base.
Because see, we don't have to go. We have to be on the wall itself.
On the wall itself.
Wall itself on the hidden side. Don't fall down completely. Don't reach down completely on the bottom. Otherwise, you will reach on the concha. Okay.
Yes. Similar to tragus, thalamus yesterday.
Yeah.
Similar.
So right. Like the similar.
Slightly up.
Yeah.
Slightly up.
Yes.
Yeah, just next to thalamus.
Yes.
Thank you very much, sir.
Welcome.
Thank you.
Welcome. Begum ji. Yes, please. Begum ji. खुशबू मेहता जी.
सर
Yes, please.
ऑरिक कलर का जो कोर्स करवा रहे हैं ये बेसिक है या फिर एडवांस पूरा मतलब पूरा कोर्स कंप्लीट कोर्स है?
ये एक ही कोर्स है, कोई बेसिक एडवांस इसमें नहीं है. दिस इज द कंप्लीट कोर्स.
कंप्लीट कोर्स.
या
ओके. थैंक यू.
आयना जी. Ainoti.
Hello, sir.
Hello.
I have a question about spine problems. Since you mentioned you treated using ear helix.
Yeah.
But you also mentioned, if I recall correctly, another line is like brainstem occiput to the
Okay, got it.
membrane. Is that also brainstem? So I was confused.
Yeah. So you're thinking that we have a spine there and as well as we have a spine here, right?
Yes.
So the thing is this, I will suggest, I will tell you something like, see, suppose if we see if we see some round structure, so nucleus will be in the center, right?
Right.
So from the nucleus, if we draw the straight line till the periphery. Okay. Yeah. So that line in the periphery reaching to the helix or not? Reaching to helix? Are you getting my point? Okay, maybe I have to do more.
So sorry.
Okay, no problem. I will show you here. So look at here. So this is the one round structure. And this is the central line or the nucleus. Or we can tell it 0. And this round structure is the outer rim or the helix. Now suppose we have a spine here, cervical spine, thoracic spine, lumbar spine, right? So from the 0, if we draw the line like this, so this is the cervical spine.
Oh, is it the difference between spine?
So the thing is this,
spine?
so what I want to tell you, this is going to treat the cervical spine, but the shadow, where the shadow coming on the helix, that will also treat the cervical spine. So now I will show you in the ear. So look at here in this image. Because this thing in the detail we will discuss in our regular class, but you have asked, so I'm telling you right now.
Thank you.
Suppose this is the point 0. And we want to treat cervical spine. So this is the cervical spine. This is the cervical spine, right? So I will draw the line from the 0 like this. So where the shadow of the cervical coming on the helix, that is also going to treat the cervical spine. So in this way, the helix is the very, very wonderful part. It can treat each and every problem happening inside just by if we draw the line from the nucleus till the helix. Suppose someone is having problem in the spine in this part, we can also treat where the shadow is forming in the helix. So this I am telling you just in the 1 minute. So just trying to make you understand, but this is the shadow concept, where the shadow will be projecting on the helix, that also will treat the same part of the spine. Getting?
Okay, thank you so much.
So in this way, we have the complete representation of the spine on the helix. Yeah, thank you. Okay.
Thank you.
Yeah. So I think the questions are over. So thank you so much, everyone. Now we'll do the 5-minute break. Then we'll do the recap in Hindi language. अब हम 5 मिनट का ब्रेक करते हैं, फिर हम अपना हिंदी में रिकैप करेंगे, हिंदी में समझेंगे. थैंक यू सो मच.